We just heard that person's successful weight loss journey from making lifestyle changes. Dr. Edgardo Maldonado with Cone Health Healthy Weight and Wellness is with us. So let's just first tackle this, because I think a lot of people feel this frustration. Why is losing weight so hard?
I think the first thing that we need to realize is that this is a chronic disease, just like any other chronic disease. It's not personal failure. And, it's a complex interaction between our genetics, our environment, stress, lack of sleep, right? Our food has kind of degraded, our lifestyles have become more sedentary. So it's a very complex interaction between these influences. Now, what people don't realize is that, when humans evolved, we evolved in scarcity, during times of famine, right? So we have these protective mechanisms that help us conserve energy. So anytime we try to lose weight, our body feels threatened. So in an attempt to protect us, he will increase your hunger hormones. He will decrease your sense of fullness. He may also have an effect on your metabolism, and that's why losing weight is very difficult, and a lot of people have weight regain as a result.
All right, and is that kind of the same, what you just described, the same as like the biology of why some people have a harder time losing weight?
So there are differences in genetics, and that's why you sometimes see that obesity could run in families. And now there's some researchers at the Mayo Clinic that have developed some testing that could give us more insights into people's biology. But that's the reason why not all diets work for everybody. That's why some people respond very well to GLP-1 medications and other people don't. The same thing would apply to gastric surgery.
All right, so when it comes to weight loss, a lot of times we focus on the number that's on the scale, right? We just want to get to that different number on the scale or the amount of weight that we lost. What should we focus on instead?
I have some patients that just have a horrible relationship with their scale. They kind of tell me, well, my scale's really mean, talks back to me. And I really tell them to focus on your overall health, right? Kind of look at, hey, how is my blood pressure doing? How are my blood sugars doing? Am I sleeping better? Am I able to walk without feeling winded? Am I able to do things now that I couldn't do before, right? Kind of focus on those non-scale accomplishments, which could really add up.
Okay, so for people who may be really eager to get started losing weight, they just saw that story of Wesley. What are some of the first steps that they should do to get started?
I think it's figuring out your why, right? You need to have a strong why is it that I want to lose weight? Second, start off simple, but be very specific. Don't just say, hey, I want to lose weight. Say, hey, you know what? I'm going to start walking 10 minutes during lunch. I'm going to eat more fruits and vegetables. Um, Partner with a healthcare provider or a multidisciplinary team because that does increase the chances of succeeding. The other thing is garnering support from your family and friends, controlling your environment, right? Make sure that your environment is set up to help you succeed, right? So reduce the presence of ultra processed foods, have the availability of healthy foods, right? That helps a lot of people kind of get started.
All right. So when people think about, you said, getting more fruits and vegetables in your diet, when it comes to eating a healthy, balanced diet, what does that sound like and look like to you?
So a healthy eating pattern is basically a diet that's high in fresh fruits and vegetables, right? You want to look at variety, you want to look at textures, you want to get all those nutrients and vitamins that nature offers us, right? Getting about 5 servings per day. Whole grains are also important. That's where you're going to get your fiber, you're going to get nutrients. And you want to get about 3 servings a day of whole grains. That's your brown rice, your quinoa, your whole wheat. You also want to leverage the properties of protein, right? So eating lean proteins like chicken, turkey, fish, tofu, eggs, low-fat dairy. Proteins tend to help you when you're trying to lose weight because it gives you that appetite suppression. It also helps preserve muscle mass, which sometimes occur as people try to lose weight. Healthy fats also play an important role. The thing is, we really cannot eliminate any particular food because we can't get all of our nutrition from just one type of food. And that's why I think diets that eliminate certain groups
Hmm.
of food may not be the most balanced way to eat.
And I think that's really good news for folks who are like, oh, I can still eat a little bit of this if I just add something better that goes with it, this, that, and the other. All right, what we're going to do, we're going to
Absolutely.
continue this conversation. We're going to be talking about physical activity when we come back.